Now that open enrollment in the Affordable Care Act marketplace is open, it's time for our annual walkthrough of healthcare.gov. I'm Bryn McBride.
And I'm Ryan Coe.
And we're going to start, Ryan, by just looking at the healthcare.gov website. And the first thing to point out is that it's healthcare.gov, not other web addresses.
Right,
And people get mixed up.
There's a lot of imposters out there. You got healthcare.net, healthcare.com, healthcare.org even is
And
not.
none of them are the right place.
Nope.
No. If you go to one of those other sites, you're going to a site operated by an agent or a broker or someone trying to sell insurance, and it's not going to give you the same protections as healthcare.gov. So that's the first thing to note. The second thing to note is that it looks very similar to last year. So that makes the shopping experience, a little bit easier. There aren't as many new pathways to learn. The two green buttons on the front page are the same as they were last year. You're either going to log in to renew your coverage and take stock of what it looks like, or you're going to start a fresh application if you're a new user. So if you do go to that login to renew button and click on that, what you're going to see is a prompt right away to enter your username and password from last year. Now, a lot of the advice we usually give folks is even if you liked the insurance you had in 2019, it's still worth your time to go in and look at your profile, look at your options before you just let it auto-renew.
Right, things change
A
throughout
lot
the year.
changes.
I mean, your income could change, the plan coverage could change.
It could be on either side. It could be you that's different, your household size, your income.
Yeah.
It could be the plan that's different. It might cover a different network, might have different doctors. The premiums might have gone up or down. You want to know that in advance so you don't get surprised later. Let's, though, go to that take the first step to apply button. And this is how people new to insurance are going to start. The first thing to note is you're going to pick your state. We're in the state of Wisconsin, so we'll scroll down and pick Wisconsin. If you pick a state that operates its own state-based marketplace, you're going to be rerouted to that marketplace. We are here in Wisconsin. We use the federal marketplace, and it's going to then prompt us to create a profile for the first time. Put in your contact information, create a username and password. You're going to start doing some of the security steps, answering some security questions, and you're going to write this down or keep it secure so when you do come back to this in the future and you do, like say you're signing up for 2021 coverage, you can then just review your profile with that username and password and you're on your way. So you're creating your profile, the security questions, and you're well on your way to creating your account and then shopping for coverage. So it's kind of like shopping for something else online. It's pretty easy so far. Let's now click through and start answering some of those questions as if we've already created our profile. Let's start taking a look at some of those eligibility questions. A lot of the questions centered on healthcare.gov are going to try to identify the number of people in your household, your age, your income, your household income. That's going to be helpful to determining what kind of coverage you might be interested in, but also the prices. The marketplace does use those MAGI rules, the modified adjusted gross income rules for determining eligibility for financial assistance. That's why it's asking about your income and your household size. Let's just make up an individual. Let's say it's just you that's applying for coverage and click continue, and it's going to have you tell a little bit more about yourself. We're going to pick an age. It has you select a gender. And then it's going to ask questions of, do you have access to other types of insurance? Do you have Medicaid or insurance through your job? That doesn't necessarily mean you're not eligible for a marketplace plan. It might just impact some of those tax subsidies that could be available.
Oh, okay.
If you have access to Medicaid, for example, you would not get tax credits in the marketplace. You should be looking that way. It might also, if you're a brand new user and your income is very low, it would route you to your state Medicaid program. It would say the marketplace isn't the right place for you. So there are a couple things going on behind the scenes here. Let's click none of these and click next. Confirm your household. As soon as you answer a question in the marketplace, it's always going to have you confirm your answer. There's an opportunity to edit it once you actually see what you type. Good way to avoid typos and also a way to double check some of your answers.
It's also going to give us like a summary at the end too, right, where we can look at everything?
It really is. That's very helpful, especially if you're doing this quickly. We would encourage people to take their time. That's why you start early. You don't wait till December 15th.
Right.
You start early, and then really pay attention to those summaries and those snapshots so you don't make mistakes.
So what are we looking at here, Bren?
Just the summary of household members. We said it's just us. If you said, oh no, I forgot to add that I do have a tax dependent, I have a child I want to include in here, you could go back and edit your answers.
Okay.
But let's just hit confirm and say it's just us. You're going to give an expected 2020 income. And they do have a little hover over above the box where you type your answer. That's going to give you instructions of how to answer this question.
Okay, that's helpful.
Yeah, let's just go ahead and put $30,000 for the 2020 income. It's looking at expected annual income. Click continue. And again, we're going to confirm our answers, but you get a prompt as soon as you type in income that gives, based on the household size and your annual income, it's going to give you an estimate of your tax credit. So it's saying, based on the income and household information you provided, your household may qualify for an estimated premium tax credit of $167 a month. That's the amount of the tax credit. Now remember this, because when we're looking at plans later, it's going to give us the premium price taking this tax credit into account. So your actual premium will be reduced by $167.
Okay.
It's going to show us the math, but it's good to remember that you've already had a discount figured in.
Mm-hmm.
This is an estimate until we verify exactly what the income information is, but it's a good number to keep in mind. Let's click View Plans. Now we got some pop-ups. And take a couple minutes to look at the pop-ups. It's actually helping you navigate the site.
Okay.
It's going to show you that there are hover-overs or pop-ups for definitions. If it says, there are premiums associated with this plan and you're not completely sure what the word premium means, you can hover over it. If it says include your dependents, it might have a little information button and you could hover over to see how they define dependent.
Okay.
It also is showing in this screen for the pop-ups, it's pointing you to some of those other green buttons and white buttons. You can do some filtering of plans, you can do some sorting, you can compare plans side by side. So the nice thing about the marketplace is it's going to give you a little reminder of some of the extra features available to make your shopping experience a little nicer. So this was just those quick reminders that they can help you define terms and you can start doing some filtering. And then you're going to get another reminder of the levels of plans available for sale in the marketplace. They're divided by metal tier.
Mm-hmm.
It doesn't indicate quality. They're all good plans, good qualified health plans in the marketplace. A bronze plan is not lesser quality than a gold plan. What's different is how you share expenses with the plan. So the costs are divided differently. A bronze plan, you will see that there might be some premiums that might be a little lower. It might then mean that you might have some higher out-of-pocket costs associated with it. So how you split your cost with the plan is how those metal tiers are divided up. So they define this for you when you're logging in and doing this for the first time so you don't get confused. Let's say see all plans. So now what you're actually, if you scroll down a little bit, we are in the marketplace looking at plans that are available in the network that we identified when we logged in and told them where we lived. We said we're in Wisconsin, we're in this zip code, and it's showing us the plans that are available for sale in this zip code.
Nice. So this is a lot of information, Bryn. Could we maybe spend a little time breaking this down, what we're looking at?
Yeah, and just pick a random plan. Just scroll a little bit, find one that you like the one in front of us.
That sounds good.
So you will notice the layout. Actually scroll down the page a little bit more. You're going to see this layout for every plan.
Oh, okay, it's consistent.
Is consistent. And let's pause on this one. Let's look at this prime bronze right in front of us.
Okay.
Estimated monthly premium is that big number on the left-hand side, and it says $107.47. And this is where, remember that $167 tax credit? This is the estimated monthly premium that includes the $167 tax credit. So it says this plan did cost $274, but because you got $167 as a tax credit, what you see as your monthly premium is $107.
Okay.
So it's already doing the math for you. Sometimes people get a little confused about what the tax credit is and what their obligation is.
Mm-hmm.
So they are showing you the math right on the page. There are a couple other buttons here and features. You can see the plan detail button as long as we'll go from left to right. As long as you're already on the left, you can click that blue button that says plan detail. And this is consistent in its design for every plan that's listed on that page as well. So go ahead and click the plan button. And it's going to lay out its estimated monthly premiums, the deductibles, which is part of your out-of-pocket cost. It gives an out-of-pocket maximum for that plan and an estimated total yearly cost. And this is important for if you're doing some comparison shopping for what your estimated total yearly cost may be. Even if you find a plan that you think has a really low premium, there might be this really high yearly cost associated with it. So you don't want to be confused later about what you were expecting. There is something new this year in the marketplace, and if you scroll down a little bit, it's the star rating. This
Oh.
is brand new, and let's see if this plan has one. It does.
Oh, that's neat.
Not all plans do. This one does. They give you a rating based on a couple metrics: member experience, medical care, plan administration. Some plans that weren't being offered last year, there isn't a lot of consumer experience with them, so they won't have a star rating in that category.
Okay.
So it's a guide. It's not definitive, but it was something that had been requested, that enough people were interested in, and the marketplace did make it happen. So that's just, it's like reading Google reviews. It's a way to just kind of get a sense for what other people were talking about based on their experience with that plan.
No, that's great.
And it's brand
It's a
new.
nice summary.
But don't be surprised if you click on a plan and it doesn't have a star rating. Not all of them do. But for some, if you're on the fence deciding between plans, that might be something that helps make up your mind. Scroll down a little bit further. Under that star rating, we also see that all plans will have plan documents, summary plan documents, that you can download, you can view. They're typically provided in a PDF format.
Yeah.
A lot of them do include that list of covered drugs. Now, if you're someone that has a very specific prescription regimen and you're comparing between two plans, you might put those list of covered drugs side by side and take a look at that. Hospital services, cost and coverage examples. There's a lot of detail provided, and this was just under that plan information button, like a little bit more detail on every plan. This was one of the enhancements of the Affordable Care Act. It was sometimes, before the Affordable Care Act was even signed into law, it was quite difficult to actually get copies of summary plan documents. Now you get to see a lot of them before you even purchase the plan.
That's nice.
So let's go back. We were looking at that blue button. That green button, you can like this plan. That's something that's just a note to self. If you were reading through a lot of them, it helps you just keep track. There are other ways to try to keep track of plans you like too, to put them side by side in an apples to apples comparison. So let's jump to the right side, and you see it right there, the compare button. Let's say we want to compare the plan we're looking at right here, and then scroll down a little bit to the next one or pick one, and you can hit compare again. So we have just selected two plans with the compare button. Scroll all the way back up to the top now. And you can see that blue box has been populated. Of the 59 plans available, we clicked compare on two separate ones. So now it's saying compare these two plans. And now it's going to put them side by side. So you can see the total estimated monthly premium of, that first one we clicked next to the second one we clicked. You can compare the apples to apples on every single line that was available for those two plans. You can click a couple more and compare a couple side by side. You can put two side by side. It's a really nice shopping feature. If you're looking at these side by side and you decide, I like the one on the right or I like the one on the left, once you scroll to the bottom, go back to plans, there is a way for you to then, and you know what, right above that compare button, I'm seeing that star rating is showing right there on the home page as well. But if you are liking this plan, you can go back and click that one and it's going to remember it for you. So if you compare them and you like one more than the other, go ahead and document it. Say, I like this plan. It's going to then facilitate the plan you like. It's going to then facilitate you going ahead and purchasing that plan as you get close to the end. So let's go back one screen, back to where we were just shopping. There are other ways to filter plans, and you can see that filter plan button right up at the top. You can filter by premium, by deductible, if maybe some of the eligibility for a health savings account. There are a lot of ways you can filter the plans that you see presented in front of you. But you also can notice up on the top right, you can filter if you're looking at a health plan or a dental plan. And there too, you could also filter by premium or deductible.
Oh, very
so
nice.
There are a lot of ways that the site is making it easier for you to compare the plans available in your network to make sure that you're learning as much as you can as you're clicking through all of these plans. So let's now go back to the screen we had before. Unclick the compare button on the two plans we had clicked. And that's just going to take us so we can kind of reset our expectation. And go back up to the top now and let's filter. Let's do a sample sort by. So on the right side of the screen, we have the health plan, and let's sort by deductible, just for an example of what that actually does. And you can see right away it puts one of the no deductible health plans right up at the top.
Okay.
So there are some people that will say like, well, show me the cheapest premium plan and put that side by the cheapest deductible plan. And I just want to see what the differences are. And you can see based on, your available affordability, what you consider to be affordable. You can see, would I rather have the monthly premium as opposed to would I rather have a deductible? There are also questions when you first log in, and we skipped over this when we first logged in, where you can assess if you're a frequent user of the healthcare system or a not so frequent user of the healthcare system.
Okay.
That will then help you determine whether or not one of these high out-of-pocket cost plans and low premiums might be more beneficial for you as opposed to the other way around. If you use the healthcare system a lot, that might mean a lot of copays and deductibles. So you might be looking at a plan that has a little bit cheaper deductible if you're using the healthcare system a lot. So they're just ways based on how you use healthcare might determine how you buy plans in the marketplace. Now this is still as easy as this is compared to shopping before healthcare.gov, where you really couldn't put some of your plan documents side by side before. You couldn't see deductibles and an apples to apples comparison before. This makes it so much more uniform and streamlined. But that being said, it's still confusing.
It sure is. So what do we do about it?
They provide on healthcare.gov a way really easily to find help.
Okay.
So
let's go into that a
let's
little
go right back to healthcare.gov, the homepage. If you scroll down a little bit on the bottom left, you're going to find local help right in the middle row. Yep. There are multiple ways to do this. There are a couple ways on the healthcare.gov homepage. It'll say find an agent or broker, find local help in my area. You click the find local help, you're again going to put in your zip code, and you can start sorting right away of whether you want to talk to a navigator or a sister, a certified application counselor, for instance, or if you want to sort and just find insurance agents in your area. Help is available because this, as easy as it is, can still be confusing. And
sure
you can
can.
start getting confused over what your final cost obligation might be or what networks look like. And what the best insurance plan for you and your family may be. So take advantage of that find local help, find a navigator or a sister in your area, make an appointment, and try to see if they can't be helpful as you try to do your shopping. Let's go back to healthcare.gov one more time. It's a site that's useful to just click around it a little bit. They have a get answers, there's frequently asked questions. There's a glossary if the hover overs to provide a little bit of a definition or more information are not available. The glossary is very robust and will help lay out some of the expectations. And there's always going to be a reminder of the deadline too. And we can't stress that enough. If you are using the federal marketplace, December 15th is your last chance to purchase insurance. If you're in one of those states that has a state-based exchange, the deadline might be a little different. So just be very aware of when your state says this is your last day to buy insurance. Hopefully you will never get to that point because we really do encourage people to start early. This takes a little time. So make sure you allow some time, that you sit down and have all your information organized, the names and birth dates and social security numbers of everybody in your house, last year's taxes, if you bought a health plan on healthcare.gov last year, your username and password. Get organized, sit down, try to crank this out. Once you create your username and profile, you can come in and go as much as you want, log in and out, save your work, and it's something that you can access much more easily, but give yourself plenty of time to read that material so you know exactly what you're getting into. I think that's enough of a brief walkthrough of healthcare.gov. We're going to link in the description below to some of those resources of some toolkits that might make shopping a little bit easier, kind of demystify the process, another link to how to find local help in your area so you don't actually have to go log in and click around on the website. We'll take you right to that, and a couple other toolkits and resources that might make this experience a little bit easier for people that might be shopping for the first time.